As the coronavirus pandemic continues into the winter, tonight many health experts are keeping a watchful eye for double trouble, flu season added to COVID-19. NBC 15's Corey Pippen continues our team coverage live in Baldwin County. Corey, medical workers are worried about passing the breaking point.
Kim, health officials say an active flu season could be more difficult for hospitals already dealing with COVID-19 and more dangerous for patients with symptoms.
A drop in COVID-19 cases and hospitalizations may have eased the burden on local hospitals. But tonight, South Baldwin Regional Medical Center's chief of medicine says they're also preparing for the reemergence of another deadly virus, influenza.
The worst case scenario would be an active flu season and a very active coronavirus season. Even a low to moderate coronavirus caseload with an active flu season would put a significant burden on our bed capacity, our staffing, and our PPE.
Dr. Mark Noer says since coronavirus and the flu can appear similar, a patient showing symptoms for both would be isolated for COVID until test results come back.
If they had a flu screen that was positive and failed to improve, those are the patients you would worry about also treating them as a coronavirus.
Even more dangerous is the possibility of contracting both diseases. Dr. Michael McBrearty, chief medical officer at Thomas Hospital, says getting either one could increase those chances.
It's just like if you get flu and then get pneumonia. The problem with it is if you get them both, you're going to have two different viral diseases going on, and that just sets you up for the bacterial infections.
State health officials say the flu and pneumonia killed more than 1,200 Alabamians last year. But like COVID, mask wearing and social distancing can help prevent the spread.
We really have to do all we can to keep the COVID-19 transmission down, as well as influenza transmission, so that our healthcare system will be able to take care of the patients who need to be hospitalized.
Health officials recommend getting an annual flu vaccine by the end of October. They say even if it's not 100% effective, it could still reduce the symptoms and duration if you happen to come down with the flu. Reporting live in Baldwin County tonight, I'm Corey Pippen, NBC 15 News.